Microbiology. Today our topic is airborne diseases. We divided 4 parts. The first, common cold. The common cold, also known as a cold, is a viral infectious disease of the upper respiratory tract that primarily affects the respiratory mucosa of the nose, throat, sinuses, and larynx. The signs and symptoms: cold, start from runny nose, scratch or sore throat, and sneezing, low-grade fever, watery eyes, headache, fatigue, and body aches. The treat. We have 3 ways to treat: drugs, self-care, nourishment foods to eat. The drugs. Analgesics relieve symptoms. Self-care. Always talk to your provider before starting anything. Use decongestant, nasal spray, and cough syrup. Nourishment food to eat. Foods rich in vitamin C, such as oranges. Prevent. Wash your hands with soap and water. Disinfect kitchens, bathrooms. Sneeze into tissues and discard them. Avoid sharing items such as cutlery. Avoid close contact with people with colds. The second, influenza. Commonly known as the flu, is an infectious disease caused by influenza virus. Signs and symptoms: fever, runny nose, sore throat, muscle pain, headache, coughing, and fatigue. Acute respiratory distress syndrome. The treatment: drugs, self-care, nutrition food to eat. About drugs: antiviral drugs used to treat specific viral infections. Self-care: drink plenty of water, get plenty of rest, eat healthy foods, practice good hygiene. Prevention: vaccines, influenza. Be sure to wash your hands regularly with soap and warm water. Clean surfaces, such as keyboards, phones, and doorknobs, regularly to eliminate germs. Use a tissue to cover your mouth and nose when coughing or sneezing. Meningococcemia. Meningococcemia is a rare infectious disease characterized by upper respiratory tract infection, fever, skin rashes and lesions, eye and ear problems, and possible a sudden state of extreme physical depression which may be life-threatening without appropriate medical care. Signs and symptoms: neck stiffness, headache, nasal and vomiting, fever and chills. The treatment. In children, penicillin is still the treatment choice. However, other organisms must be ruled out before treatment is begun. For persons who are unable to take penicillin, other antibiotics are used such as cefoxitimab or ceftriaxone. Prevention of meningococcal cases and outbreaks through vaccination is the best control strategy. Leprosy, also known as Hansen's disease, is a long-term infection by the bacteria. Signs and symptoms: light or red patches of skin, reduced tactile sensation, numbers, weakness in hands and feet, joint pain, nerve damage, weight loss. Treatment: drugs. Procedure: nutrition first treat. Procedure: surgery for patients with persistent nerve pain. Reconstructive surgery, correction of deformity. Prevention: people live in the same household and the patient should be screened for leprosy and treated if they have symptoms. The BCG vaccine provides some protection against leprosy. Early diagnosis of the disease can help prevent transmission. Strep throat is a disease in which the tonsils at the back of the larynx contain infection with pathogens and is a type of bronchitis. Signs and symptoms: throat pain that usually comes on quickly, painful swelling, red and swollen tonsils, sometimes with white patches or sticks of pus, fever, headache, swollen tender lymph nodes in your neck. 3 ways to treat. Drugs. Antibiotics get rid of bacterial infections. Procedure: tonsillectomy, remove of tonsils to treat recurrent strep throat or tonsillitis and other complications. Nutrition for treat: warm liquids such as hot cocoa, warm milk, and soups. Prevention: try to avoid contact with people with sores. If you have someone with streptococcus, wash your hands often. Don't share toothbrushes. Diphtheria, caused by infection by bacteria called Corynebacterium difficile. Signs and symptoms: chills, sore throat, cough, headache, rapid breathing. The treatment: drugs, metronidazole. Patients with allergies to penicillin G or erythromycin can use rifampin or clindamycin. Prevention: diphtheria vaccine is the best choice. Measles. Measles is an acute, highly contagious viral disease caused by infection with the measles virus, common found in children, and is one of the common acute respiratory infections in children. Signs and symptoms: fever, feeling of grogginess or drowsiness, cough, loss of appetite, dry cough, tear-eye, sneeze, whole body aches. Treatment: drugs, analgesics, relief fever and muscle aches, nourishment, self-care, rest, increase fluid intake. Prevention for don't eat food that have been identified as causing symptoms, rub or scratch, contact stress. Mumps. Mumps are common known as pig cap or mumps is a disease caused by the mumps virus. Signs and symptoms. Swelling of one or both parotid glands causing swelling of the cheeks. Fever, headache, muscle soreness. Treatment, drugs, self-care, nourishment. Analgesics may be used to relieve pain and fever. Prevention. Getting the mumps vaccine is the best way to prevent. Avoid contact with an infected person. Don't share antiseptic cups or water bottles with an infected person. Rubella. Also known as German measles and 3D measles, is a type of measles rubella virus disease caused by infection. Signs and symptoms: mild fever or mellitus, headache, redness of the eyes, rash. The treatment: drugs, analgesics, relief pain, nourishment, food rich in antioxidants. Prevention. The method of prevention is regular vaccination. Chicken-pox, a disease caused by initial infection with varicella zoster virus, is highly contagious. Signs and symptoms: fever, headache, feeling of tiredness, and general discomfort. The rash may appear in 3 stages: small rash, pink or red bumps. The treatment, drugs, and self-care. About self-care. Prevention. Vaccination against chickenpox can prevent infection. This ink I reference. Thank you.